Welcome to TCM Board Formula Series. Today we review Huo Ji Sheng Tang, Angelica pubescens, and Taxilus decoction. It belongs to the category Dispel Wind Damp and Tonifa Deficiency. The herb photograph shows Huo botanical, Angelica pubescens, medicinal part, root. The fastest memory hook is this: chronic cold damp painful obstruction plus liver kidney and qi blood deficiency needs both expulsion and support. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Huo dispels wind cold damp from the lower body. Sang Ji Sheng and Du Zhong and Niu Xi strengthen liver, kidney, sinews, and bones. Qin Jiao and Feng Feng and Xin dispel wind cold damp and relieve pain. Dang Gui and Chuanxiang and Bai Shao and Chu De Huang nourish and move blood. Ren Shen and Fuling and Zhi Gan Cao support Qi and the middle. Ro Gui warms the channels and assists Yang. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Huo. The deputy level is Sang Ji Sheng and Du Zhong and Niu Xi and Qin Jiao. The assistants are Feng Feng and Xin and Rogui and Qian blood tonics. The envoy role is Zhi Gan Cao. Together, the formula dispels wind cold damp, relieves pain, tonifies liver, kidney, qi, and blood. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is chronic wind cold damp painful obstruction with underlying liver kidney and qi blood deficiency. Look for this clinical picture: chronic low back or knee pain, heaviness, numbness, stiffness, or weakness, pain worsened by cold and damp weather, fatigue with weak lower extremities. The tongue is pale with a white coat. The pulse is deep, weak, and slow, sometimes wiry. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Wan Bai Tang a Euro upper body wind damp pain without deep constitutional deficiency. Shen Tong Zhu Yu Tang a Euro fixed severe pain from blood stasis. Yu Gui Wan a Euro kidney yang deficiency without a dominant wind damp by pattern. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: use only verified Asarum species and professionally prepared products. Aristolochic acid contamination is dangerous. New weakness, bowel or bladder loss, saddle numbness, fever, or traumatic pain requires urgent evaluation. Use caution in pregnancy and in frail patients sensitive to warming or dispersing herbs. Modern medication review includes: blood-moving herbs warrant review with anticoagulants and antiplatelets. Zhi Gan Cao requires review with diuretics, digoxin, corticosteroids, and potassium-sensitive conditions. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1, chronic bowel syndrome. Number 2, lower back and knees. Number 3, cold damp and deficiency. Number 4, tonife while expelling pathogens. Number 5, verify XIXIN identity. The one-line recall is, chronic cold damp painful obstruction plus liver kidney and Qi blood deficiency needs both expulsion and support. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Huo Ji Sheng Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.